Okay, we are live. Go ahead.
Okay, we're gonna just fix the camera really quick and then we'll get started. There we go. All right. Okay, welcome everybody to our March meeting of the Board of Health. We're gonna go ahead and get started. We are live. We do have someone here today for privilege of the floor. The general manager, Greg Conrad from Hotel Ithaca. So 3 minutes to go ahead and share with board members anything you'd like us to hear.
Beautiful. Well, first I'll say my last name is actually Kennard, not Conrad.
Oh, sorry.
People make that mistake. So I'm here to make a plea to you guys about a penalty fee that we incurred due to a violation of emergency lights that we had during the 2 inspections that we had. I don't know how aware everybody is, but on December 19th, we had an inspection where we had a violation of emergency lights that were not, a number of emergency lights that were not working properly. Upon learning that, my maintenance staff then put in an order to, because our emergency lights are special order, they're wired in, so you can't just go to Home Depot and buy them. So we put in an order to do that right after that inspection. On January 3rd, we were notified that they were on back order for us, at which time we did receive a amount of them. I can't remember the exact amount on here. It's not specified and I don't remember because Adriel, I thought Adriel was going to be here today to give specifications, but we did install about half of the emergency lights by the second time that Adriel came. But unfortunately, for your guys' guidelines, that still was not enough to satisfy what we needed at the time. And that was January 21st when he came back, at which time we did let them know that that order had been delayed. And then after that, I don't know how aware you guys are, but on January 23rd, we suffered a critical sprinkler pipe burst in our south tower, which basically came down from the south tower 10th floor all the way down to our lobby space, which basically put our entire tower out of commission, which it is still under complete construction. And when I say complete, I can show you pictures of it stripped bare bones down to the studs, even like just whole complete construction. Due to this fact, my maintenance team had then shifted their focus to try and salvage as many and mitigate as many rooms possible on the south tower. At which time we did address Adriel to let him know that unfortunately, if he was going to come back in that subsequent next couple of weeks, that our focus had shifted to this, unfortunately. So we did not at the time get to the emergency lights being up to speed. So 2 weeks after that, when finally we had mitigation through, when I had my whole staff through, we were able to install up to the full amount of working emergency lights in the facility on that north tower where we had the violation. So I just wanted to give you the background of where this came from. As far as I know, in my tenure and to the previous GM's tenure, we have not had any violations like this in the past. So I just wanted to appeal to you guys for the penalty fee incurred, and to, I was hoping Adriel would be here to speak as well, to show that we had been in constant contact to let him know the situation at every point of where we were with those emergency lights. And, you know, we are up to code currently. So
Thank you.
let's see if you have any questions or.
Are there any questions from board members? John?
It looks like there was an additional inspection and it was found that the ice machine had some
Yeah, that
issues. That's that been taken care of as
that
well.
was taken care of at the second.
Okay.
Yep. That is correct. He brought that up to us on the second. That, so again, if you want to speak to Adriel, he'll let you know that on his subsequent inspection, everything else was taken care of.
Any other questions from board members
Yeah.
or vendors?
So sorry, I'm just looking over this. The penalty was $400. And you're hoping to have that removed?
If possible, given in lieu of the situation that we incurred with the timing of ordering, it being delayed, only getting half the order, then having focus shifted to our south building because I only had 2 maintenance people and they were working 7 days a week for mitigation on that building to try and get as much water mitigated as possible.
Right. Yeah, I mean, my only concern is that, so from, sorry, again for the date,
That's okay.
mid-December. I guess one question I have is, so the inspection was on December 19th.
Correct. Which we placed the order December 23rd.
How long before December 19th were the lights not working?
That we do not know, admittedly. They all went down, it was, and Adriel will tell you this, it was almost, there were about 3 floors worth that all went down at the same time, and they were all batteries. So I'm assuming when we ordered them and installed them, we installed like floors at a time, and just they all failed subsequently at the same time.
Okay, and how frequently do you do tests of these lights?
Generally monthly.
So it could have been November, hopefully November.
Yes, correct. And that I can show documentation on. If you guys need that. I appreciate your guys' time.
Thank you so much for
Thanks so much.
coming. We appreciate it.
Received another letter. I've never been through this process. I apologize.
Yeah, environmental health will be in touch.
Okay.
Okay, after we, because we'll talk about it again. So
I appreciate you guys very much in your time.
Yeah,
Thank
thank
you.
you.
Thank you so
Thank you
much.
for coming out. We
No,
appreciate
no,
it.
greatly appreciate sparing the time for me. Have a good day.
Yeah,
You too.
bye-bye. Okay, let's move to approval of the February board in the packet. Although the one thing I did notice is that the actual date of the board meeting isn't on it just says MMDD. Okay. So if we could make that update, so it's just clear when it was. If I could get a motion to this written the vendor with the minor change that I'm requesting. A second for that, Shauna, any additional discussion? Any other error, any correction? Okay, so all in favor of approval with the addition of the correct date. We have 1 abstention, and did you vote? Oh, and everyone else was approved. Okay, next up is the financial summary. Yeah.
Okay. We did try to provide a little bit of information that, from NYSHO around federal funding. Although by the time I put this in the packet, it's probably changed 3 times, it seems like. But, we are just making sure that we are in constant contact around any federal funding that might be impacted. And so I just wanted to give you a brief update. I don't have any that's being updated, significantly impacted yet. There's no clear take back. There's no clear non-payments at this point. In fact, in the CR, we expect that if it did hit, it would probably be later in the year. So for now, funding seems to be stable. Actually, I have somebody at another meeting right now, just verifying that with state too on some other programs. So we are trying to stay on top of it, but not a lot of clarity yet. As far as last year and this year, the county has not closed their books yet for last year. But we did not go significantly over budget in any significant way for any of these programs. So we are okay with our budget as is. And you've got now the first 2 months in the packet. We did get a budget presentation and during last week with legislators and department heads about maybe new approaches to how we budget. I don't think that there's a clear lesson from that yet. Corsa is trying to figure out what he would like and then making sure that the legislators are on board with that. But we're just looking to be able to be flexible enough that no matter what they ask for, they want to go all the way down to zero-based budgeting, which starting from scratch, that we would be able to do that. We've never done that before, but we would be able to. Or anything from there in between to just getting your normal target and doing your normal budget like we always have. So we've created a second set of books that is a little bit more flexible, just so we can do it. And then hopefully going forward, the new way will be the permanent way or semi-permanent way, so we can be a little more on top of the budget for you all and for the ledge and for Corsa all at the same time. I have the information, but there aren't a lot of avenues to give it in the right ways on a line level to anybody who would want it. So we're trying to just make improvements there. Any questions on? the
I do have a question.
Yep.
So, can you just back up just a little bit? And this also, crosses over a bit with the commissioner's report.
Mhm.
So you did mention in there about the transition to the zero-based budgeting approach. So can you just, so that we understand the difference between how you currently budget
Yes.
and the transition to zero-based budgeting? And even though you just alluded to it a little bit, I think maybe could you just take a little bit of a step back and say, this is what we do now. This is what the change to zero-based budgeting would be and the impact of that.
Okay. And just, I think it's gonna be something in between. I don't think
Okay.
we're ever gonna like all the way on zero-based budgeting.
Okay,
But zero-based budgeting would be, you are justifying your budget from zero essentially, and then just saying what you need. Versus something called target now, right? So I had a budget last year. I have budget modifications that happen all year this year. And then that's my number next year. Right from the get-go, you get a target number of this is what you had last year. And then the county admin will say, except you need to cut 5%, or it's maintenance budget. You don't have to do anything to it. Zero-based budgeting could be, in this case, well, you get all your personnel stuff right from the get-go. We know what that is. So you don't have to go to zero on that, but on everything else, do you really need all the training that you need? Do you really need all the program supplies that you put in there? Everything else could start from zero with justifications. I don't think anybody would really want to see that for a budget the size of ours. It's 800 lines long. So we do it anyway, right? We go through every line and say, what did we spend last year? Is it good? Okay, we'll update it for this year. We have to do that. But we've never presented like that to anyone where we justified every single line. And so there was conversation around what would we start with this time around? And what's the definition, right? So definition of maintenance is that all my expenses that I know are going to go up by 2%, are you including that? Or do I have to find that? And then generally speaking, once the ledge makes a decision on tax targets, we'll know, are we cutting or not? So I think there's lots of wiggle room, and I think Corsa was pretty clear on, and the trainer was pretty clear on at least looking at 5-year trends with some better accuracy around things, which we already do. So I'm very comfortable with that part. If we have to go to zero, we'll go to zero, but I don't think that's really where it's going to land.
Who's Corsa?
Corsa is the new county commissioner. So he does have a different idea about how he wants budgets to be presented to the ledge, I think, and just making sure that all of his departments are well organized and that it makes sense. Are we just talking to them about OTRs, which is over target requests, or are we talking about to them about everything? Last year was primarily about OTRs. So you got your budget and the legislative presentations were just about extra. What else to do? Is that going to be how it goes this year? Is that enough? information on that?
for me, yes. Any other questions from?
Yeah, I guess I'm just, and I'm in a negative headspace right now. But my fear is, and maybe it's Cordell too, is like, our motto is if you don't use it, you're not going to get it next time. So I fear, or I worry or wonder, like, is that how it works? Like if you have to justify, and I think you just said, we're not going to have to justify everything. But if you have to justify, like, oh, you don't need to do more training, like, or why do you need to do more training if it's not already in the budget?
Right.
I don't know. And I may have too simplistic understanding.
So the way we've done in the past, where you just get target, that gives you every way to say, if I've got a little extra money, I can put it in training. Versus if they go through it line by line and ask you a question about everything. So that's really the big difference now would be,
Right.
Are we just getting target and we as department heads and our financial people are putting it where it needs to go? Or is there more intervention from anyone else around that and more question? Which we'd be able to answer. I mean,
Right.
I'm really confident with our finances and the information we have to get anyway. And cutting most of ours when they're grant funded, you lose the revenue as well.
Mhm.
So it's not as easy as just cut that expense out. You're losing revenue as well in a lot of cases. And so we're harder to just cut. In general, I mean,
Right.
anything can be cut, but in general.
Thanks.
Any other questions?
Dr. Baker.
Afternoon. Talked about just an update on measles cases in Texas, New Mexico are in excess of 350. Hopefully, maybe with the incubation period going on and several of them, we will see a stabilization. But still that high number, and across the country, the number is even higher with other measles outbreaks in other places. It just reinforces the fact that more measles cases we have in the country, the more probability that one could come into our region by someone traveling here. So as a department, we've talked about being ready the moment that we would have a measles case come into the county, that everyone understands exactly what the role is. We have some real-time messaging to the public about it, and that we are ready to deal with it in a organized fashion. On some good news, avian influenza still is about the same for New York State, without any human cases in the state, and without any dairy herds involved. Concerns continue to be about poultry by and large, and trying to help contain the amount of virus in poultry so as to limit mammalian spread and the chance for a genetic shift that would make it more dangerous for you. I'll open up to questions if you have any about my report.
Given that mumps and rubella vaccine or components of the MMR vaccine, do you anticipate or are you aware of any increase in mumps and rubella cases?
No, fortunately. Our major concern, I think, in the county in terms of vaccination rates is to try to do as much as we can for the population that's in the younger, very young age group before they actually get to kindergarten age, where our vaccination rates are quite good. It's those younger groups. Rachel and I had a little email exchange about that problem, where that vaccination rate is in the middle to lower 80s rather than up to 95 where it should be. And some of it, we think, has to do with the fact that we don't have as much affordable daycare in our region as we need. There's the article that Rachel passed on to me was documenting a 3-to-1 slots, a 3-to-1 demand related to slots disparity in daycare, affordable daycare for people. In New York State, if you are in a bona fide daycare situation, can I use that word, bona fide? You must be vaccinated. So it's really the kids that are falling through the cracks by not being part of that point of care, or who are choosing alternative pathways that aren't getting vaccinated. So we're continuing to think how might we best approach that.
Has New York State Department of Health talked about putting out any guidance for the state on measles?
Not other than what they have done, which is to update their measles website for the public as well as for practitioners, which has detailed information about current status of measles and steps to take in terms of diagnosis and treatment.
So nothing like on guidance for schools, how to prepare. I know the district superintendents had a meeting yesterday and they were all talking about how they were waiting for information from the state. So if you're on a call with them.
They're waiting for information.
Yeah, they said we're not doing anything without the Department of Health putting out guidance, but I think people are starting to talk about like how can they be prepared. What we don't want to happen is the case to come into one of the schools and they have no idea what to do with
Am I correct that information for schools comes from the Department of Education?
I think during COVID, it would come from the Department of Education and then also from the Department of Health. And sometimes it wouldn't be clear guidance.
And currently, though, we're not under emergency.
No, I think just,
status.
yeah.
So currently, where would it come from?
I think the I mean, I don't know. I got, I sent you the California guidance and that was super informative. And I think it would help schools and private practitioners' office to, should I see this patient outside? Who should we call if we have a case? Where should we put them? Should we mask people? Should we not mask people? Should we put them in a cab? Should we send them straight to CMC? Like, I think all that would, if we had a clear sort of guidance, or at least who to call, I guess they would call you, but then who would you call? Like, if we knew what to do, then our first measles case wouldn't spread measles all over the county. I think this is my COVID anxiety coming up. Someone needs to
No,
give
it's
us
very-
guidance and we all need to be doing the same thing and know who to call. And we have an amazing community that works super well during COVID. So
It's not anxious to be eager to have your ducks in a row before you get into any trouble. But I would guess it's Department of Ed that probably interacts with the schools.
Do we have to
We can
wait for them
certainly-
though? Yeah, I was gonna say, do we have to wait for them? In absence of the Department of Education or action at the state level, can we at the county level, is it possible to provide some guidance?
Well, we have to practitioners, my most recent bulletin, which went out yesterday, drew attention to what's out there for measles updates for practitioners, but that doesn't, some of that filters through to schools because it does get distributed to some of the school nurses. But that doesn't mean that we can't do something directly. School districts get, Rachel, you can help me out here. Probably the interaction would have to be with superintendents because they control information,
For guidance.
do you think? I don't know.
Yeah, and living in.
I mean,
school.
rather than directly with school nurses who aren't,
I think you can you could filter it through me too, since I'm with BOCES in most of the districts, but I do think it's the practical stuff that we need too. So with Centralis and with, the colleges too, we worked so well together last time and just the practical, I can Google what a measles rash looks like. I could Google incubation period. We're all frantically doing that because we've never seen it, or the health providers are, but it's the practical, what it would do in our community if we suspect someone has measles. I know the PCPs don't all have a room with negative pressure that they bring kids in the back door. I don't know what we would do with the ER.
We have negative pressure.
So I guess,
Do you have a protocol in place at Centralis right now for your,
We have for airborne disease in
in
general,
general?
nothing that's measles specific.
and so if the school nurse calls me, which I will, and they think that the kid has measles, we don't want to send them straight to the ER. So I would call the ER, I would talk to the charge nurse. Maybe I would get to someone that would know the protocol. So I guess in my head, I would love to have a pre-system of just context. Does that make sense?
Yeah, and there is, I think the state has put out some, actually, there was a public health preparedness checklist put out by CDC, here's things to do to get ready for an outbreak in your area. And one of them included tabletop exercises or drills. Public health would like to be informed right away, but sometimes we're the last to know.
But you could be the first call if we had a list,
Right.
put a mask on the child. Don't let anyone else in the room. Call Rachel. We can do that. Rachel knows to call Andrea. Andrea knows that whatever it is.
Waiting room for 2 hours,
Right.
a whole bunch of other people, right?
If you can test them outside, I don't even know how you test them for measles. I should.
But I think that's the ask, right? Which is not a 40-page document about, it's a checklist. I'm random person who maybe is sitting at the front desk or whatever, and somebody says this is a person with measles, then it's okay, where's that checklist? Here's the first 10 things I have to do to make sure I don't spread it. And then somebody who knows more can take over at that point. But I think that's the point, which is we don't want to flip through a whole bunch of things. Here's the document that's Because like during COVID, we knew you have a COVID case, you notify the health department, you do this, then you do this, you do this, you do this. It's like, that's what we need. And then everybody's consistent. So Cornell Health, I see, everybody is doing the same.
I can connect you with the resources for the health system, but the major guidance comes from the state. Everything that you're describing, we would get from CDC and DOH, and then we create our own policy and standard operating procedure, and then share with everyone that utilizes the system.
And it seemed like measles is different because we know a lot more about measles than we did COVID. So I would just hope we would have that information before we had to, because sometimes I felt like you were like catching up, right?
So we have the airborne protocol, but I can get infection prevention nurse, ED manager all together in the same chain to discuss this, but that would be a guidance for the health system, right? It's not official from DOH saying schools needs to do.
But Whole Health could put a Tompkins County and then for me, little Seneca and little, like just some guidance on how to communicate. And
What do you
would be
want us to
super
do,
helpful.
I think? is
Yes,
the
yes,
question.
yes.
Like, tell us how we can help to make sure that if it happens, that we at least have the right people notified and that we don't do things that exacerbate the situation. Which by the time we know about it, will probably already be a situation. So, like,
Yeah.
Yeah, I forwarded what you sent from California DOH to a couple people at New York State DOH and said, is there anything similar being developed right now that would help?
Did they say anything?
Haven't heard any response yet.
Yeah, I mean, I think, well, again, negative space, the CDC and, I don't even know if it's gonna, but anyway. Can I go, if we're done with measles, can I go back to avian flu?
Yeah, sorry.
That's all right. I don't know.
Hold on one second. Are we done with measles? Before we move on, are there any other measles comments or questions?
Rachel, would you guys do the post? Notification.
Well, we'd want to, first of all, confirm the case, so we'd have to expedite testing to the public health lab. And then once we have a confirmed positive, then we work on, the contact tracing and.
Any other measles?
Actually, I guess I have another meeting.
Okay.
So where do we stand with this? It sounds like everyone wants to have a checklist.
I will look for resources again on the state side. I do think it should come from DOH because then it's consistent across all counties. Like, we don't want to develop something that's just Tompkins and then it's like, well, you're doing it totally different than Schuyler or Seneca.
I guess you guys have more pull with the New York State. The California guidance was great, I thought. It was super informative, but
That was specific for healthcare providers. That wasn't the school guidance.
no, but yes, that's true.
Yeah.
That's true. But it had helpful within schools that had the helpful tips too for like the nurses and
Yeah.
who's gonna get the measles cases first, who's gonna get the nurses there. So it's sort of a mini healthcare setting.
And I think we have really robust school systems in place already. That's good to remember that our vaccination rates, 2 doses of MMR are really effective in preventing, and that's required in New York State or you will get excluded from school. And there's, I don't know, a handful of medical, you might know how many medical.
There's not that many.
Right. So in Texas, the situation is very different, very, very different. So we do have a strong regulatory environment here for that, which is somewhat reassuring, but right, measles is one of those viruses that's very, very infectious. So there is someone who's unvaccinated in contact with a positive measles case, so chances are they will get it.
But in private schools, do we have the same?
Private schools still have to comply with this.
They're supposed to.
And where are we with the doctor in town who was helping people not get vaccinated?
Oh,
Sorry, that may be off topic.
it's an allegation. It has been mentioned from several disparate sources. It is under investigation. See, I think I'm allowed to say this. We have past information that we have collected to the New York State Department of Health section, which is responsible for investigating such allegations. I heard that they've received the information. And it currently is going through that process of investigation.
Okay. Avian flu.
I'm just curious, how big is the commercial egg production system in New York State?
Oh.
I don't know if anyone knows the answer to that.
Yeah, I think there are a lot of eggs produced, but I don't know anything to be able to tell you how we rank to other states or, but et cetera, et cetera.
Okay.
Yeah. I will say this, that the issue about vaccinating poultry flocks gets you into some very interesting
Right.
territory because it gets you into the retail commercial market for poultry products. And internationally, that becomes an issue because when you vaccinate poultry, then they produce antibodies to avian influenza. And then you lose the ability to screen animals for avian influenza by doing serologic testing because you've induced the serology. So in the United States, the decision historically has been not to vaccinate and instead to control in the manner that it has been, that we have been doing. But that debate, I think, has been freshly rekindled.
Yes.
So how it will turn out is anybody's guess, I think.
Thanks.
Okay, any other questions on that report? Okay. I think we're back to you.
For Commissioner
For
report.
Commissioner's report. Yep.
Okay. So we hit the first bullet pretty well. Second bullet is the commissioner's posting is now up, and I just wanted to thank everybody on this board that contributed to that job description and getting that right. That was really helpful. So there is a link there that you can use to please share with whoever you share with to get the word out.
Jeremy, I have a question on that. And I didn't look at the posting. Is there a closing date for that? Like when will we shift to?
Yeah, it's the first time is 30 days, so
Okay.
14th, April 14th.
April 14th. Okay.
Sorry, I should have it. And then we have some strategic planning and merger updates. We are sort of at the point in our integration where we've integrated admin teams very well. We've opened a Brown Road clinic up here, so we have service providers up here. We've got a pretty good internal referral system going so that we can across programs get clients to where they need to go. And now we're sort of looking to take the next step, which is a little bit more formally clinical services working together rather than just a referral from one to another. And so we are sort of pausing, and you can see what our efforts are there. There's lots of things listed. We're doing trainings around it. We're doing trainings around tools. We're developing tools. We're trying to increase our automation, different things like that, where the flow of information is easier. Every time we try to integrate any two programs, you find out all the different ways they communicate, and they rarely line up. So we're trying to get some more standardization across the board, or at least know how to better talk to each other. If we're going to have clients that are shared, and we're going to better serve them, which is the intent here. The intention is certainly to have the client have a better experience every time they walk through the door here. So we're putting a lot of effort into that right now. We have a ton of findings from the strategic planning that we've done so far, and we're pausing hopefully long enough to implement several of them, the key findings that we have so far. And then the fall time will come around and we'll do some more cross-functional teams. But in the meantime, we're trying to implement some tools. The rest, there's some other detail there. Any questions about what's in the report?
Thank you. Rachel, anything to add to your report?
Yes, I will just add, I neglected to include in my report a section on oral health now that we have the board's support in our survey and efforts. Well, just to report back to you what we're doing month to month with that information and the survey that we put out. Sam's team did issue a press release for World Oral Health Day, which was March 20th. And we included in that press release, we're interested in hearing from members of the community and forming like a sort of committee work group to start talking about how we're going to move forward with the next steps of this process. So Dr. K and I and Sagarika are all working on that. And Sagarika did some outreach at the library on World Oral Health Day, handed out free toothbrushes and information on how to help kids, especially with healthy oral habits. That's the update on that. Did I miss anything, Dr. K?
Anything else for community health questions? So, great, thank you. Sam?
I just wanted to share that we did take on an intern. There are two actually in the department this spring. And her name is Rashid Husseini, and she's working on media and reviewing some of our website web pages, and also thinking about creating different activities or certain information based on some of the community events that are participating in. He's an undergraduate for now. Global and public health. Be going into the Cornell MPH program. And it seems like the first time almost that we're going through the internship program that we had established more the higher ed partners a couple of years ago. I did have one intern last summer as well, but I think we're getting more staff involved in the process. So hopefully it'll continue to build. And then the community health survey closed at the end of February, and we ended with about 2,266 people who had opened the survey and about 1,800, a little over 1,800 who completed the full survey. So it's more than we've had in the past. So we're analyzing the data, and we'll be creating it into the community health assessment process. And last thing, I just wanted to, we won't meet before National Public Health Week starts April 7th. So just wanted to put that out there too.
Are you doing anything that we
don't have anything specifically planned, but yeah, our one of the teams. In the past, sometimes we put out questions about it, but we also would be a good time to plan more for next year.
So I'll skip her report unless there was somebody else that is saying. All right, Liz. You're up with your pretty brochure.
I'll start with the not so pretty inspection report. I realized I was looking at the CROSA enforcement action that one of the inspection reports, the December 16th report, was not included in the Board of Health packet. So you have a hard copy of that handed out to Board of Health members. I don't know that everybody here got a packet. So that's why you have that. And then CSI, Community Science Institute. It's an organization that's really grown since my time here, and the services and that they provide and our involvement with them. They do our sampling, they do the HABs sampling during the summer. They have a contract with us for that. They also have a contract with us to do stream monitoring to get water quality measurements throughout the county, which is very helpful, and all of that goes into a publicly available database. And she dropped off, Grayson, the last name, I don't know if I can pronounce it right now from the cuff. She dropped off a number of these brochures, and so I thought that they might be of interest to the Board of Health members. So that's why that's available. And I think the last thing I'll mention is Applegate Mobile Home Park is has come before the board on several occasions, and So they were supposed to be in compliance by the end of the year. And I can't say that they are in full, they're partially in compliance. We do not think it is beneficial to bring them back for additional enforcement at this time. So we're just going to kind of monitor the situation, and we're hoping maybe it'll be better in 2025. So I just wanted to relay that to the board, because they weren't not in 100% compliance with the orders that they have, but not too bad overall. So that's the position we're taking in environmental health, but I wanted you guys to be aware of it. So. And then I don't know, Holly, do we need to mention anything about the end of the agenda, end of the meeting, or?
Probably just wait until.
Okay. And that's all now.
Any questions on the report? Go into enforcement actions. Okay, we have I've got everything right. Yep, 2 enforcement actions. The first one is the pizza company related to food temperature holdings, both cold and there's lots of degrees on here. So you can have, if I can have a motion to approve as written. I have a first from Ravinder. Second from Andrea. Discussion on this. Liz, is there anything that you need to add that isn't already in here?
No, just the post penalty is for holding and.
Any questions from board members? Okay, all in favor of approving as written? That is unanimous. Okay, second enforcement action is the hotel Ithaca emergency lighting action. So if we could have a motion to approve as written. First from Ravinder, second from Melissa. Okay, discussion on this. Liz, actually, before we open for discussion, anything you want to add? Yes.
He explained a number of the things. They did meet the March 6th deadline that is mentioned in the enforcement order. I think the only other thing that I'll point out that relates to his request for consideration of a penalty reduction is that, some of the emergency light violations were also cited in 2023. That's in the case. So I wanted to point that out. It appears they didn't have any reserves on hand.
Okay, board members, thank you, Liz. Yes.
Or when you say they don't have any reserves, you mean reserve equipment, just in case there's a failure?
Like extra light bulbs in case they go out.
Okay. But I thought he said it wasn't a light bulb issue, so.
Well, it's a wire,
Yeah.
it's wired, but it is the lighting,
Oh, okay.
right? But he doesn't have replacement parts, I guess is the better way to phrase it.
Any other questions or discussion on this? Board members want to talk about? Okay, all who would like to approve as written?
Oh, sorry.
Sorry, let's go.
What am I approving? That we're gonna charge them?
Correct.
Great.
Approved as written. Okay, can we ask that one more time? Because do people need a moment to think? Or do you want more discussion or something else? Go ahead, Shauna.
So I guess I am sympathetic to the fact that a lot of things are on back order these days. And it does sound like they've put some preventative maintenance, and he did say that they have logs that they're going around every month. I guess I would make a motion to reduce the amount from 400 to 200.
I'm not a second, but I'm just a question.
Go ahead.
So Liz, with regard to logs, is that something you look at or do you?
Those are internal maintenance logs. They're not required by us.
Okay.
In the 2023 violation, was it recommended that they keep extra parts on hand? I realize he could be a total different manager at this point from 2023, but
That's not normally something we would.
it would just be like, oh, I should keep some of these on hand just in case. Yeah.
We don't normally get into their ordering process.
This is emergency lighting for evacuation of the building, like, so like these, like when the power, but there's a fire, lights go out.
I don't know, yeah, they had a water issue that took some inventory out of circulation. But they still need to keep in mind the people who are actually in rooms. And that's the troubling part for me. It's like, yeah, we get it, but there's people paying and living in your hotel. And if, you know, God forbid, there's a fire.
Thoughts? Okay, so no, I just want to come back because you proposed a motion too. So I don't want to, are there any other questions or thoughts before we come back to entertain this? Holly, I might have to ask you about Robert's Rules of Order because we had a motion proposed while we were under motion for something else. So do I need to first address this and then, or do I need to address the motion that we were under first?
You have to address the motion that came first.
Okay.
So, yeah, so that motion can't be,
This motion
yeah, the one, because the first motion was to accept
as written.
penalty as written.
Yeah.
So you have to take a vote on that one first.
Okay.
And then,
We can entertain that one.
yes,
Which-
unless the person who made the first motion wants to
I'll
withdraw.
withdraw. Yeah, that's fine. If there's no one that wants to second, I'm fine to withdraw. And some you lose some.
All right, so we're back under the original motion of to approve as written. So all in favor of that motion? Okay, we're unanimous. Thank you. Any other motions? Okay, all right, so I would like to make a motion to go into executive session. So if I first that, or do I need someone else to first that? Can I make a motion?
Yeah, and you would say the reason being, potential litigation. You would say that the reason to go in executive session is for, you have to put the reason on the record that it's would be potential litigation.
Okay, the reason.
I would say about who or what.
Okay, so motion to go into executive session because we do need to discuss something that is subject to litigation. Okay. That's my first, second from Ravinder. All in favor? Okay, great. So we'll excuse staff from the room.
Okay, staying though.
Liz, if you could stay, please, and if the say as well. Please.
The recording.
I need to turn the recording off as well. Is that? Oh,
I was just saying.
okay, yes. So we can, I don't know, Zoe, are you?
Yeah, she's checking on that. So you go ahead and end the live stream and the recording. It's like